Dear patient, are you anywhere in Uganda looking to meet a specialist doctor? Are you even aware that there is a platform that has come to help solve that for you? Just right where you are, anywhere in Uganda, you can access that specialist that you're looking for in a time convenient for you. This new idea, this innovation is purely Ugandan. It's called the Medical Specialists Link Uganda.
Medical Specialists Link Uganda. Yeah. So this is an application where a patient and a doctor is linked. Now, this application has selection of doctors who qualified at a level of a specialist in their respective fields of study, and they are registered on the app, waiting for you, the client, to book them and go see them. So the real essence is to solve the problem of you walking into a clinic without knowing the patient, the doctor that is going to see you, what kind of qualification that doctor has, and the experience.
At a very, very small charge, okay? And as the doctor, you can actually see the patients that are looking for you by just registering to Medical Specialists Link Uganda. Look out for MSL in a link shared in this video. Also find it in your search button on Google Play Store or anywhere. You will find MSL UG, and once you try it, you will never regret it. I have tried it myself. I find it very easy to book patients. I find it very easy to make my appointments. It catalyzes them and it makes it better to access patients. Try it yourself. You will not regret it.
Hello, our beloved viewers watching UMA TV. It's a pleasure having you once again. My name is Dr. Sechanzi Henry. I'm the CPD chairperson. CPD is Continued Professional Development for the Uganda Medical Association. And yes, I'm your host today at UMA TV. You realize that there are so many innovations that are coming up in medicine with the new changes, the new problems that are coming up, newer solutions are coming up. And among them is one of the things that you're going to discuss today. Realize that things like AI in medicine, so many great interventions are coming up. And all of these are helping us solve some of the biggest challenges that we have in medicine. Joining me today are two doctors. Interestingly, these are my undergraduate colleagues. We were attending the same class as undergraduate, but right now, they are specialists. And they are here to discuss with us one of the newest innovations on the block. It's called MSL UG. MSL UG is Medical Specialists Link Uganda. But I'm not so good at this. These guys are going to tell us more about MSL UG. And yes, it's a pleasure having you doctors joining us.
Thank you so
yeah,
much.
I'll request that you please maybe speak closer to the microphones.
Yeah, thank you so much, Dr. Henry.
Yes.
Thank you.
Yeah, I'm going to request you to introduce yourselves, but I think I'll start from our extreme right with you, Dr. Mark. Yes, tell us who Dr. Mark is, and yeah, just greet our viewers.
Hello, viewers. It's good to be here. I am Dr. Mazenga Mark. I am an obstetrician and gynecologist. It's good to be here.
Thank you very much, Dr. Mark. Yeah, as I said, we are OBs. We had some undergraduate class. I have to tell people that Dr. Mark was actually my high school OB. Yeah.
Yes,
so it's our thing.
Correct.
It's a pleasure having you, Dr. Mark.
Good
Yes,
to be
Dr.
here.
Kello.
Yeah, thank you so much, viewers. Thank you, Henry, for having us. We are really grateful to be at UMA today. And I am Dr. Okello Robert. I'm also a gynecologist. Dr. Mark has actually been my classmate.
Oh.
And then all of us have been classmates at undergraduate at Makerere, and thank you so much.
Wow.
And thank you for having us.
Awesome.
Yeah.
So it's a doctor's conversation today. Yes, you're going to discuss. But I mean, our conversation will not be so complicated. You know, people are so scared about whenever they see doctors, they think you're going to speak very difficult words, you know. So it will be a light conversation today. Yeah, so MSL UG, to somebody who doesn't know it, to somebody who is hearing it for the first time, what should come to their mind?
To their mind, yeah. Yeah, thank you so much. MSL UG actually stands for Medical Specialists Link This is kind of an innovation that we came up with. We have actually seen a lot of problems that people go through in accessing doctors. But then, for your information, Uganda is one of the countries that is endowed with a lot of medical specialists. There are so many, but then again, we find that people actually keep asking us, people calling that, can you link me to this kind of a doctor? I want to see this kind of a doctor. I have this kind of a problem. Yeah, so we realized that I think we needed to do something to make sure that people out there can access us, doctors, especially specialists. Yeah, so that is how this innovation came up, and we wanted to digitalize this medical consultation so that you can access these medical specialists all over Uganda. We are actually among the top countries in having specialists in the different fields of medicine. Yeah, so that's how we decided to come up with this connection so that we can link clients direct to the medical specialists who can handle their exact problem, other than just moving into a clinic and then you get anyone to see a client.
And even so, you know, as a specialist, patients are looking for you, and they don't know how to find you. So this application, this innovation, MSL UG, is also going to assist doctors in meeting their patients. Yeah, it's a schedule appointment kind of application. So a doctor, in a way, will also find it easy to get those that are looking for him or her. Yes.
So both ends, you're connecting these two parties.
Yes.
Patients to doctors, doctors to patients.
Yes.
Wow, awesome, awesome. Is it a Ugandan app? Is it a Ugandan innovation? You know, I don't know if you heard about Bubu. Buy Uganda, build Uganda.
Yeah, exactly.
Is it a Ugandan innovation, or there's some Bazungu somewhere and maybe, I don't know.
Yeah,
Is it
exactly.
Ugandan?
Yeah, that's a nice one. Yeah. So this is an example of a bubu. It's one of the bubus. It is actually from Uganda, made by Ugandan doctors. The idea came up from among a number of doctors within Uganda, because basically we understand what happens within Uganda. That do you have someone in Mulago to connect me and all this? So we wanted to solve this problem at once, and it is exactly from within Uganda by the Ugandans.
Awesome.
Yes.
Awesome.
Yeah.
So, assuming I have my phone, I'm a patient. I have my phone and I want to access a gynecologist. Maybe Dr. Mazinga can tell us. I have my phone and I want to access a gynecologist, and I've had this MSL UG. So what do I do?
Okay, so Dr. Mazinga is listed among the specialists in MSL UG, and all a patient needs to do is to download the application. A link is going to be shared in this video. You download the application, register, put in a few details, really, very few steps. Then just type in the search button, look for obstetricians, gynecologists. Okay? So Dr. Mazinga will be listed according to the region you're looking for. If you're looking for a gynecologist in Kampala, he will be among, and the hospital where he is found. Also, the time he sees his patients will be indicated, plus the consultation fee. All you need to do is to click on Dr. Mazinga and then follow the steps that allow you to book an appointment.
Okay.
Yeah.
Awesome, awesome. I don't know if Dr. Kelly wants to add on to that.
Yeah. So it's exactly what Dr. Mazinga has said. All you need to do is type msl.ug on your Google search. You can still go to the site. But most importantly, to make it easy for you to use, you can download the app from the Play Store, and you have it on yourself. Get a few details registered, log in, and so you create an account with the app. And at any point you need any specialists, the client is able to just go there, as Dr. Mazinga has said. You look for whichever specialist you want, choose the consultation fee that you can afford, choose the location that is near enough for you. That's how simple it is. And most importantly, what we promise you is that the people that you see on the app listed are purely specialist verified, and therefore you are not going to see anyone less of the cadre that you need, less than a specialist. That is exactly what it is.
Wow. Wow, awesome. So it can either be through the app or directly to the web. I can connect
Yes,
directly to
You
the
can
web.
actually type MSL.UG on the web.
The way you type, you type in any other thing in your search button on your Google. Type in MSL.UG and you're good to go.
It takes you to the platform.
Exactly.
There you can put in a few details. You register. I think for the first time you have to register.
So, yeah,
Yes.
you create an account
Okay.
and you are able to access any specialist and book.
Okay.
Yeah.
Awesome. Sounds good. A Ugandan innovation. A Ugandan app.
Yes.
A Ugandan website.
Linking Ugandan doctors to Ugandan patients. Yes.
This is so good.
Yeah,
This is so good.
Yeah.
Okay, so yes, I've gotten this app, or maybe I've gotten to the to the website, and I've gotten there. I've clicked, and I've found my specialist. How do we pay? Isn't it very expensive? How do they pay? How does a patient get to pay this doctor?
Yeah, exactly. So, as you could see, the intention behind this application is actually to link people who can afford a small fee to private doctors who are available, and strictly specialist doctors. You are not going to get a general doctor or someone who is not qualified specifically in that field. Now, the problem that this app also solves is what you're trying to ask. That am I not going to get? Is it not a very expensive things and all that? No. You, before you choose a specialist that you intend to see, because if you go to, for example, an obstetricians, you're going to see a number of them, a number of gynecologists available, and they have listed where they stay or where they see their patients from, and also their consultation fees. Now, it is upon you to look at the experience of the doctor, the consultation fee that the doctor charges, and the location of the doctor, and you choose one that is convenient for you.
Okay.
So in that sense, you're not going to go in for someone very expensive or all that. And that is what we request doctors: as you register your consultation fee, you make sure you're competitive enough.
Okay.
Exactly. So that solves that overcharging where you pay a consultation fee for a specialist and you end up seeing maybe a clinical officer or a medical officer or someone not in the field of your condition. So we try to solve that in that manner.
So after you've selected the doctor that you wish to see, for example, Dr. Okero Robert sits at a given hospital and the time is convenient for you, and you've booked an appointment. For you to confirm that appointment, the app will require a small fee, okay? Very small fee of Ugandan shillings 2,000.
Okay.
Yes, and the payment is pretty quick, really. Yeah, you can pay with mobile money. You can pay from credit card. Yeah, the options will be there. You just need to follow the prompts. All you need is access to a smartphone or a computer to do this.
Okay. Wow, you guys are making it so simple to see a doctor, to see a specialist.
Yeah.
Awesome.
As it should be, really. It shouldn't be so difficult, which is why we came up with this. We think that people shouldn't struggle to meet the specialists they are looking for. We also think that doctors shouldn't struggle to meet the patients that are looking for them.
Yeah.
Okay.
And patients should not be cheated by walking into a clinic and then paying for a consultation and seeing someone who may not necessarily be a patient in their field of of studies. Yeah. So it's
So for example, I am a gynecologist, but I could see someone who needs a general surgeon.
Yeah.
So if you enter a hospital and for some reason the general surgeon is not around, I could sit in their position. With MSL, that is not going to happen.
Yeah.
You will definitely be seeing a general surgeon if you need a general surgeon.
Exactly.
Yeah.
Wow. This is good. This is a very beautiful innovation, and I'm sure it's going to help our people greatly. So I imagine, yes, I have gotten my app or maybe my website. I've gone through all these. I have that small fee that it requires. How do I get to see the patient? How do I get to see my doctor? Is there a virtual way I see them, or I have to visit them physically? Or like is there a virtual platform I can see a doctor, or I have to visit, I have to drive, or maybe get a board and find this doctor wherever they are?
Exactly. So I think you're now trying to find out how it works.
Like exactly how does it work?
Yeah. So basically, for the clients, let me start with the clients. You as a client out there, you'd go into the app, look for the doctor that you want, choose the time that you want to see that doctor. Remember, during registration, the doctors also put off days that they can't have any bookings for them, and therefore you can't book them for those days. So you choose a day that the doctor is available to be seen, and also the time. And you pay for the consultation that the doctor has indicated on his dashboard. Now, if you have all those done, you're going to get on your dashboard as a patient. You're going to see all the details of the doctor that you have booked, and also all your details that you have entered goes to that particular doctor, both in his email and also in his dashboard of the app. Now, the two of you are linked. Now, during the booking, you also choose whether you want to do a physical consultation, which would mean that you want to go to the doctor's clinic and see the doctor physically, of which the doctor has indicated it there. Or you can say, probably I just want to inquire or get advice from a professional about this condition of mine on what to do, or I have already done some investigations and I want an interpretation of those results by a specialist in that area. Then you book that doctor for a video conference. Now you agree on the time that you want to have that video consultation with that doctor. So that would mean it's convenient both for you as the client or the patient and the doctor. Can even be in the evening at the comfort of your living room, and then you chat with the doctor. You can upload your results, maybe investigations, a scan results, or the results of the laboratory, and then the doctor looks at it, gives you advice, and tells you what next to do. If it necessitates a physical meeting, then you arrange with your doctor after that video conference, and then you have your consultation done also physically.
Also, if you have actually booked this doctor, say for example you want to see Dr. Mazinga at so and so hospital at midday, that doctor will have the role of making sure his schedule is clear by midday of that time. So all the patient needs to do is to keep time, go to that hospital and say, I have an appointment with Dr. Mazinga, okay? And the nursing team and the triage team will know exactly what to do.
That's, I think, going to solve this problem of patients waiting so much in the lines. I've had patients narrate very terrible experiences where they go to a facility maybe at 9, hoping to see a doctor at 10, and they end up seeing them at 4 in the evening. So it happens quite a lot, but I think with now MSL UG, that's going to be solved.
Now, there's a small part that I wanted to talk about. Like, give an example. I am out of the country, I am out of the country. I have my relatives, my dear ones, for example, in Gulu. And I would like to book an appointment or have them seen by a professional. I don't want them to be cheated where they go to a doctor they don't know, and probably they are not that advanced enough to understand what happens in a hospital. So from wherever I am, I'm in Kampala or I'm in any other place or even out of the country, I can just go to MSL, book a doctor located in Gulu. Maybe if I know that needs a physician, I book a physician for my relatives. I then send the details of the doctor to my relatives. They go and see that doctor. So there I am very sure that doctor is the one responsible for the condition that I want and in the location that I want. So I don't need now to try to say go and look for a doctor yourself or try to, go and find out who you can get, and there you mess up and you get problems. That's it.
Okay. Wow. Interesting. That means I can book for my sick mother a doctor when she very far away from where I am. And maybe I just call them and be like, hey, please go to such and such a facility, tell them like this and this, and they will be seen.
Yes.
And
wow.
here are the details of the doctor. And your appointment is at this time in this place.
Wow, wow, wow. Thank you very much, Dr. Mark, for highlighting that. And from what you've just said, it looks like this is something that we really need. It has come at the right time. We're having a lot of technological advancements, so many innovations coming up. And yeah, with this innovation, our patients are going to be connected to doctors. Doctors are going to be connected to patients with just a text. Is it even a text? Just a few clicks away.
Yeah.
A few clicks away, a few phone calls away, and yeah, people get connected. Very, very interesting conversations, and I hope you're enjoying it. I hope you're learning it. I hope you're learning quite a lot, and I hope you're seeing how innovations are going to improve healthcare. And in the long run, we shall live very good lives and very decent lives. Now, Dr. Kello, I want to come to you and ask you about doctors. Yes, we've talked so much about patients, how they can get the app, how they can get these specialists. Now, I want us to talk about the doctors. How do doctors get onto the applications? How do you get all these doctors? How do you fish them? How do you hunt them? You get them onto the app to be able to be seen by patients. How do doctors get onto the system?
Yeah, thank you, Henry, for that question again. Yeah, so this basically goes to our dear specialists out there that we request that we embrace kind of technology so that we get clients and we offer our best, because I don't think any obstetrician is comfortable managing a diabetic patient. And these are kind of advantages that we shall get. We offer the best for our clients because you deal with the client in your field of study. Now, this application actually has nothing to do with getting money from the doctor in any way or anything, as we already said. It's mainly to make sure that we link you to the patients, and therefore it also has advantages to us as doctors, which I think Dr. Mazinga is going to talk about. Yeah, so how do we get onto this app? It's basically assessing yourself and knowing that, yeah, I think I have some free time that I can attend to private clients. So basically we want to connect you to clients who are able to pay for your consultation. And we request that you charge the same consultation that you would charge for your ordinary clients or walk-in patient that comes into your clinic. Kindly charge the same consultation and put it on the app so that the patient is going to look at it and say, I think I can afford this, and pay for your consultation. And that would mean that every kind of update that comes to you that a client has booked to see you means that client has paid for your consultation, and therefore we request you give it attention. If anything, contact the patient and make arrangements for adjusting the time if need be, because we know that you can put a day and time that you will be free, and unfortunately you can get any kind of emergency situations and you are unable to attend. So make sure you reach out to the patient, because you will have all the details after you have been booked for that appointment. Now, how do we register? Yeah, so registering is simple. We are going to have a link down in this podcast, and you are able to go to the link. And in that link, it stipulates all the terms and conditions that you're going to operate. And before you register, you read through the link, through the terms and conditions of your operation with MSL.UG, and you register. Now, registration is simple. We only request that you register all the details that are necessary, so that, or whatever is put there for you to give the details, so that we are able to give the details that is necessary for the patient to make a choice of which specialist to choose. Now, in your registration, we also require that you put your practicing license number, which is registered with Uganda Medical and Dental Practitioners Council, so that helps us to verify that actually you're a specialist. Now, that is why we promise our clients that the specialists you're going to see solicited on this app are strictly going to be those who are registered with Uganda Medical and Dental Practitioners Council, and therefore they are valid to operate in the areas that you have registered. So basically that, go get the link, read terms and conditions, and register your services. Make sure that you fill all the details that is required on that registration page, so that you appear fully well for the clients to choose. Thank you so much.
Wow, it's self-registration.
Yeah.
They don't have to walk into an office
Yeah.
or come to your office,
Sure.
say, Dr. Kell, I've come to register.
No, sure, it's self-registration. And we are going to share the link everywhere on the platform of doctors. And on this very platform, you're going to get it at Uma TV page. You're going to get the link, and then you read through and register. And we really request that you do it as early as possible, so that you be available for the clients to see you and book you. Let's help our client as specialists, surely. Let's not be so hidden that it's very difficult to get us. We studied to help clients, so let's avail ourselves in such a platform. We must digitalize medical consultations.
Yeah, we are getting digital. Everything is getting digital.
Exactly.
I've seen these days, back in the days when we were doing ward rounds, you would move with very big files, file on file, but these days people move with a simple laptop.
Files at all. Just a tablet and a computer. Yes.
So we are getting digital, and you're making the work much more easy.
Yes.
Nice. So Dr. Mazinga,
Yes.
this app, this platform, how is it going to help doctors? Yes, we've seen how it's going to make it work easy for patients to get to see their specialists. Then on the other side of doctors, how is it helping doctors? How is it of an advantage to doctors to be on this platform, those specialists? How is it helping them, and what sets this platform apart?
Okay. Thank you for that question. I will start with a question to the doctor listening out there. Dear specialist doctor, apart from your classmates, who knows you? Who else knows that you exist? Who else knows where you work from? Okay? So, with MSL UG, you get to be known. Okay? A patient out there, you're operating in Isingiro. You are a specialist physician. Patients are in Isingiro and they are coming to Kampala to see physicians. Okay? So we want that doctor anywhere, in Imbarara, in Iguru, in Kapera Byong, to actually be seen and be known. Okay? So yes, MSL will actually get you known to patients, and it will grow your clinic. I know that every patient, every doctor in a private practice is looking to grow their clinic. Try MSL UG. Your clinic is going to overwhelmingly grow. Okay? But now, if you do not want to grow your clinic, for some reason a patient has asked you, or you have wanted to refer a patient to a specialist colleague, for example, a rheumatologist, okay? Or a pediatric cardiologist. And we doctors have actually been looking for these specialists ourselves, and we can't find them. We do not know where to get them. With MSL UG, you can actually find the specialist to link your patient to, or to link your relative to. You know, as doctors, your whole clan thinks you know everyone that can treat their particular condition. So for some reason, you are looking for a gynecologist and you actually don't know where to send this patient or to who to contact. With MSL UG, you can access all of these. See how advantageous that is?
Wow. This is making life very easy.
And most importantly, by the way, registration is free for doctors. You don't have to pay a penny to avail yourself for these clients to see you.
Registration is also free for patients.
Actually,
it's just booking that is charged a very small fee, but registration is free for both the doctors and the patients. Yes.
Awesome. It's cheap for that matter.
Yes.
Very cheap for that matter. And it's going to save us transport costs. It's going to save us time. So, and I feel like time is the most important resource. So if any innovation is coming up and it's going to save somebody time, instead of somebody going to wait in lines for so many hours, walking, sometimes a patient will walk, or maybe will have to move 4 or 5 times before they get to see the specialist. But now with this platform, somebody can actually arrange and they just move when they need. They're not going to have to wait for so much time. So it's going to really save us time, save us resources, and in the end it will make us better economically and in our health.
Exactly.
Okay, awesome. Thank you very much, doctors, for making this simple for us. For me, I've understood everything, and I imagine our viewers out there have understood. But maybe another question I'll ask you. So yes, maybe we've seen what it takes to get his first booking. What happens for these other subsequent bookings? Because in my specialty of internal medicine, we need to see our patients routinely. You don't see them at once, and it's not a one-time off. Sometimes you may have to review them, see them after 3 months, after 2 months, or even 1 month. So with this platform, have we thought about that? How are we going to handle that?
Sure. As we said, that has been a question that, as MSL, and you're going to lose a lot when you link a patient to a doctor, and then later on they continue to interact without coming back to the app. And to me, that's absolutely normal. Our intention is not to collect as much money from you as possible. If I link you to a physician and you're a diabetic or you're hypertensive, and you're able to get care from a competent physician, that's what we have achieved in a nutshell. So you can continue to link up with your doctor for as long as you need. But definitely we also know that the same person who is diabetic has children, and if a child falls sick, will not go to that physician.
They'll need a pediatrician.
We want a pediatrician, and you come back to MSL, get a pediatrician, and get there. The next day you need a gynecologist, another one a rheumatologist, orthopedic surgeon, and all that. So we don't mind linking you once to a doctor, and you continue interacting with your doctor for as long as you still need the doctor. And same thing for the doctor.
But sometimes your doctor sees you today, and then they are hard to schedule an appointment with. You still can come to MSL UG and reschedule an appointment with that same doctor.
Exactly.
Wow.
Yes.
Okay, awesome. MSL UG is here to solve our problems, to make our lives simple, and in the end, we shall have better health. As we're winding up these doctors, I want to ask for your concluding remarks, but probably you could direct them, one, to doctor specialists who haven't registered yet, who are seeing this video for the first time. What do you have to tell them? And then also to our patients who don't know where to find the specialists. What do you have to tell them? I think I'll start with you, Dr. Mark.
Okay. Thank you. Now, one word to the specialists. MSL is here for you as it is for the patient. Please make good use of it. You are just few clicks away from your next patient. And to the patient, now you no longer need to travel from Isinjiro to Kampala to meet an orthopedic surgeon. Click on your phone. Like you scroll on TikTok or on WhatsApp, you can actually find an orthopedic surgeon in your close proximity.
That's what I was going to say, that if someone might think that I'm coming from Isingulu, I'm going to pass through Mbarala and everywhere, but actually maybe there's a good orthopedic person around in Mbarala, and you can just stop there. And,
exactly.
You don't have to come to Kampala.
Try MSL UG. You will not regret it.
Awesome. Thank you very much, Dr. Mark. Yes, Dr. Kelo.
Yeah, thank you. And to the colleague doctors, I just want to emphasize that let us embrace this kind of technology. Let's avail ourselves to our patients, and we serve them rightly. This MSL, as you have known, will solve a lot of problems. Just like patients, you wouldn't want to walk into Mulago, walk into any clinic, you don't know the doctor you're going to see, but with MSL, you walk into a clinic, you know the time you should meet your doctor and which doctor you're going to meet. You know the qualification, you're very sure you're going on point to what you need. Thank you.
Wow, awesome. Thank you very much, doctors, for making this very easy for our patients as well as the doctors. I hope many specialists are going to get onto the platform, and they're going to be found by these patients who are looking for them, and things are going to work out. We are going to help each other. Wow, it's been a pleasure having you.
Thank you for having us.
Yes, and our beloved viewers, thank you very much for keeping it up to this moment. By the time you've watched up to this point, I'm sure there's something you've had to learn. I'm sure you've understood this newest innovation. Please share this link to somebody who might benefit from it, and even for yourself, should you need a specialist anytime soon, should you need to see a consultant, a specialist in any discipline, you now know the answer. Share this link with your colleagues, with your family, with your friends, so that they also get to benefit from this information. And together, we are going to build a very, very healthy society that will live to see that most in all aspects of life. Thank you very much for keeping it to MATV. That should be it from us for now. We shall catch up with you next time. For now, have the rest of your time and have a good time. Bye-bye.
Hello everyone, I'm Dr. Kelo Robert. I'm a gynecologist. I would like to bring to your attention the existence of a new app on the block that is working within the country for the moment, called MSL UG. It is MSL stands for Medical Specialists Link Uganda. Yeah. So this is an application where a patient and a doctor is linked. Now, this application has selection of doctors who qualified at the level of a specialist in their respective fields of study, and they are registered on the app, waiting for you, the client, to book them and go see them. So the real essence is to solve the problem of you walking into a clinic without knowing the patient, the doctor that is going to see you, what kind of qualification that doctor has, and the experience probably, and the consultation that they charge. So we request that you use the application to get to the doctor, book the doctor prior to the consultation time, and then you walk into the hospital where the doctor works with a consultation page, and the doctor is actually expecting you. That makes consultation much better. And to the doctors, kindly, for now that the registration is free, avail yourself by registering for consultations in this platform. Go to msl.ug or download the app as RJ MSL Uganda from the Play Store and join the platform as a doctor and serve the nation. Thank you.
Dear patient, are you anywhere in Uganda looking to meet a specialist doctor? Are you even aware that there is a platform that has come to help solve that for you? Just right where you are, anywhere in Uganda, you can access that specialist that you're looking for in a time convenient for you. This new idea, this innovation is purely Ugandan. It's called the Medical Specialists Link Uganda. With just a few clicks away, you can actually access the doctor that you want at a very, very small charge. Okay? And as the doctor, you can actually see the patients that are looking for you by just registering to Medical Specialists Link Uganda. Look out for MSL in a link shared in this video. Also find it in your search button on Google Play Store or anywhere. You will find MSL UG, and once you try it, you will never regret it. I have tried it myself. I find it very easy to book patients. I find it very easy to make my appointments. It catalyzes them and it makes it better to access patients. Try it yourself. You will not regret it.